Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to our Facebook Live event, and it is springtime in the Berg. And the last couple of sessions we've been talking about ways to get ready for summer. So tonight we're going to do the same thing. What can we do about some fatty areas that are annoying to us now that we've shed our winter clothes and now getting ready for our summer wear? So tonight we're going to talk about the many uses of a product called Kybella. It's an injectable product that dissolves fat. And tonight we have Pamela, our master injector, here tonight joining us, and she's going to demonstrate on Beth how to do the Kybella injections. And so thank you for helping us again. Some of you have seen Beth in other productions and volunteers. So tonight we're going to talk about all the uses. I think one of the main things that people want to know is, what is Kybella? Kybella is a product or a chemical called deoxycholic acid, and that's actually a chemical that's made by your gallbladder. And the purpose of the acid is when you eat fatty foods, the gallbladder actually contracts, and the deoxycholic acid helps dissolve a lot of the fatty tissue that we eat. So now this is an injectable controlled substance that we can put in areas of fatty deposits that we have been had difficulty controlling with diet and exercise. So tonight we're going to concentrate on the area just below Beth's chin, and it's called the submental area, and a lot of people hate that. So that's what we're going to do tonight, and it's very quick and easy, and she can describe it as we do it.
Okay, so we did put some numbing cream on her to make sure she's comfortable, and we did ice this for about 20 minutes. We grafted out the area that we're going to do, and that's what the little dots are here. So we already have it drawn up, and hopefully she's nice and numb.
I am.
And we're going to go ahead and inject. So if anybody wants to ask any questions why we're injecting, maybe Dr. Antimarino can help us out in answering those. And then we can ask her some questions of how it felt and so forth.
And I have a question. Is there anything that you recommend patients do beforehand to prepare for this at all?
Really, there's no prep. If you don't want to be bruised, I do recommend that you would not take an ibuprofen or fish oil. Those kind of things can thin the blood a little bit, obviously any blood thinners, to create bruising. It's really not a highly bruisable area, but that would just be, not for a couple days for avoidance.
Are the results of Kybella permanent?
Yes, the Kybella actually dissolves the fat. It disrupts the cell membrane of the fat cell and dissolves the fat. So whatever fat is dissolved is permanent. Now, the big question between that and liposuction, both get rid of fat or dissolve fat, in this case, or suck it out in liposuction. But there's still fat remaining, and those remaining cells can actually grow or shrink depending upon if you're gaining or losing weight. So you just have to remember that we're not trying to dissolve all the fat in this area for Beth, just the areas that the excess of fat.
So far, how do you feel?
I literally can't feel anything.
So she's very comfortable.
It's not painful at all.
And you can see it's pretty quick. This can be coming in for just a few minutes over lunch or at the end of the day. You can actually have this done and go back to work. I think most of our protocol is no exercise for just 24 hours, so there's very little downtime with this.
How quickly can they expect the results?
The results are not seen for about 8 weeks. As I explained to Beth, she's going to feel a little puffy here, a little swollen, and that's usually for about 3 weeks. Everybody's a little different. So expect some puffiness for a couple weeks. About 4 weeks, she should be right back where she is today. And then over the next 4 weeks, which would equal up to the 8 weeks, is when she'll see the progression of the product going up. She will get a little skin retraction there. So the before and after pictures are very important, that you take a before and after so you can see your result.
And sometimes it can take, depending upon how much fatty tissue is there, it may take one treatment, or it could take 2, 3, sometimes it can take even up to 4 treatments 8 weeks apart.
Dr. Antimarino, what are the benefits of choosing an injectable treatment of the submental region over a liposuction procedure?
That's something we always have to kind of ascertain and talk about. when the patient comes in. In this case, Beth has just a small amount of extra fatty tissue there. So in her case, it really is only going to take maybe 1 or 2 on the outside. So if she's not really wanting to go to the operating room, and she doesn't mind sort of this 8 to 16 week of waiting, it's a good result, and it's a good way to go. Sometimes people don't want to do that; they just sort of want that one and done. Doing a small, tiny incision right here, maybe 2 to 3 millimeters in length, and just under some IV sedation in the operating room. You can do the same thing with the liposuction cannula, and it just takes 1 treatment for it usually. And there's really very little downtime from that. You have the downtime from the day of surgery, and for the 24 hours afterwards, we don't want you working or driving a car just because of the anesthesia. But after that, you can go back to exercise and go back to work in just a matter of a day or 2. So there's not much downtime with the liposuction either. It's just a trip to the operating room. So I think in Beth's case, and I would talk to her about both options for her and let her decide. I think in this case, though, I think this is a good choice for her. Some patients that are going to the operating room for other reasons, say you're going to the operating room and you're going to be doing a facelift or eyelid surgery, or for any other reason, even other liposuction for your belly, your abdomen, and you say, hey, what about this area here? I think at that point it's more cost efficient to just do the liposuction because you're already going to be in the operating room anyway. So there's many factors that we would consider before we kind of advise you which way to go.
Patricia has a question about, can you inject for back fat?
I have done small areas above the bra line, in the back. That area gets a little tender, but I have done it. It depends on how much is there, and I think that's where your evaluation comes in with whoever's injecting, the doctor, as to which way you want to go to get the best result. If there's a lot there, it's going to take quite a few sessions to wait between 8 weeks between each treatment, see the result. Or like he said, if you don't have the time to do that and you want one and done, then. But I have done other areas too. In the front, some women have had little pockets here. I've done that above the belly button, a little pocket of fat there.
Banana rolls?
I have not done any banana rolls. So far, if anybody's asked me, it's really a little too much for them price-wise. I think it comes into it.
Right.
Where the comparison of liposuction, they feel that's their better choice.
Yeah, the better choice. Now,
Yeah.
the banana roll is that little roll that's just at the top of the back of your leg, just as it meets the lower part of your buttock. And again, that's one of the considerations that we talk about, because each treatment of Kybella is a price, and so each session is more. So at some point you have to start thinking of the cost effectiveness of avoiding the operating room versus it might just be at some point maybe just less expensive actually go to the operating room for one visit. So, and again, sometimes with the banana rolls, if patients need that, they tend to need to have liposuction of the outside part of their leg called the saddlebags, or the inner part of the leg, or their hips. So you're already going to be undergoing a liposuction anyway, so it's probably a little bit easier to do the liposuction at that point. So it just depends, and that's what we're sort of judging, is how much Kybella do we need, and then how many sessions would it take to get you the result that you want, and then we sort of do the math and see which way. But again, some patients would say, I still don't want to go to the operating room. Mm-hmm. It's worth it for me to pay a little bit more, waiting those, all of those sessions out, and that's completely up to the patient. That's their option.
And that's what I asked Pamela beforehand was, does it make sense to do one treatment of Kybella? Would I need additional treatments, or is liposuction a good option for me? And if you want to talk about what, my results would look like after just one treatment versus if I'm even a candidate for liposuction.
Right, and that's something that you do in your evaluation. We go over all that. You don't have a lot there, and this is not an area that is being touched also. I feel like when you do it in other areas where in the back, women wear a bra, and that could be an area of tenderness. And if you're doing it, if you're tender for a few weeks, is that area something that you want to have tender over and over again.
Mhm.
Here, like I said, nothing really touching. People complain of it feeling tight in there underneath the tongue sometimes and a little tender. Other than that, no issues.
Would someone make a consultation with either you or Dr. Antimarino? Is it something you
Either
would
or.
direct them
Yeah.
a certain way?
Either way, and the nice thing about Pam and I are in the office at the same time, so we just had a patient very similar to Beth about a week or two ago, basically looking to do the same thing. So I discussed it with her. We brought Pam in. So Pam and I talked to her. Pam talked to her about the Kybella, how many treatments she thought it would take. I kind of went through the surgical options for her, and then we just sort of left her decide what, in her case, what would be the best way for her to go.
How quickly after treatment can she resume normal activity?
In 24 hours. I usually recommend tonight not doing any strenuous activity, just taking it easy. Tomorrow she can resume all normal activity. And somebody, if they wanted to come in on their lunch break, they could go right back to work. As you see, there's like nothing there.
Yeah, I could easily like go back to work after this. It doesn't feel painful. It feels just kind of like heat almost. And like if someone had like slapped my chin or something, just kind of like a stingy but no pain. Like I've had shots in the arm like way worse than this. It's very tolerable.
Could she wear makeup? Is it something that she would need to cover the little?
She did ask me that earlier about makeup. Anytime we do an injectable, it's considering opening the skin a little bit, and that does heal within usually 24 hours. So I told her if she wanted to keep her makeup right at the edge of the line, but within 24 hours she's fine to blend it in and come down over it. But I told her once again it might be a little tender, so she may want to not go all the way down.
Right.
There's a lot of hype right now with the jawline. I know the Kardashians have kind of had a lot of play on that. If she was looking to create a sharper jawline, would you recommend pairing this with fillers, the Kybella with fillers?
If someone has this as their considered area of wanting to take care of that, I usually recommend doing this first. And then once they're at their desired look that they want there, then I come back and I will evaluate doing a jawline. I wait until that's completely done because that could change things, once you get there. So you don't want to do filler and then come back and have to redo it again. When she gets her desired thing here, then we come back and reevaluate the jawline, then we would inject there.
Yeah, I agree with that. I think that's, otherwise you're trying to hit a moving target, and so it's best just to do one parameter at a time and then just take it slowly.
Do they apply ice? We have a question. Do they apply ice to the area for swelling?
Now, I left that up to her. I applied ice for 20 minutes prior to the treatment, and then I always let it up to the client whether they feel like they want to put ice on it, if it's going to feel better, or if they don't. She said not. She didn't want anything touching it. And that's everybody's preference. I've had some people say, yes, give me the ice pack right back. I want to hold it on there. I had other people say, no, I don't want anything touching it.
So tonight, would she, if she...
That's her choice. If she wants to, she could. And I also recommended if she has a little bit of tenderness to go ahead and take some ibuprofen or something to take the tenderness out. That's not going to hurt anything.
Can both men and women receive this treatment?
Yes.
Mm-hmm.
Do you recommend it for men so that they have a sharper jawline like we talked about? Or?
If that's something, I have done quite a few men, and if that's an area that bothers them, then absolutely. And I always explain to them too, sometimes, if it comes out a little further, we also go back to our consultation with Dr. Antimarino. What is the best result there as far as liposuction or Kybella? But I've done quite a few men, and they get a nice result, just like women.
Susan wants to know, what is the cost per injection? Does it...
Actually, during the evaluation, when you see the little dots that we applied a graft there, depending on how many you have, that's how we determine how many vials that we use. And our fee is $700 per vial. So she required one, where if it would have been a bigger area, somebody may require 2, 3, sometimes 4 at one session.
So that would change based on the
Based
area?
on the area.
Right.
Okay.
And that's why the consultations, one of the reasons it's so important is then you can kind of get an idea of what the cost is going to be. And then if you So let's say you need 2 vials and it would be $1,400, but you needed 3 treatments.
Mhm.
Now you're looking at $4,200. And so that's where the cost analysis has to come in as well. So, and we go through that. We have a patient care coordinator that will sit down with you and kind of go through those numbers with you. So you have all the information so that you make the best decision for yourself. And everybody's a little different.
We have someone that asked, could a person have an allergic reaction to the injection?
I've not heard of anybody.
I have not heard of it, and I've not had anybody with an allergic reaction.
Right. I mean, technically, you can get an allergy to anything or any medication that you take, but I've not seen it or I've heard of anybody that's happening. That's a great question.
That is a good question.
So Terry said, this is very interesting and informative. Susan, Diane, and Patricia all say hello. And I was wondering if you could talk a little bit about liposuction. I know you talked a little bit earlier, but liposuction to the chin
Right.
versus Kybella.
Right. So the liposuction in that area, there's different. Basically, liposuction is removing fat through a small cannula, which is a hollow tube like a straw. And they come in different sizes. So you actually have liposuction cannulas that are good for the face. So they're much more they're shorter. They're much more delicate than if I was doing liposuction to somebody's abdomen, back, or hip area. So there's cannulas that are 1.5 to 2.5 millimeters in width. So they're pretty narrow. They're tiny cannulas. I pretty much, it's almost routine for many people that I do facelifts on, is that making a little incision here and actually liposuctioning their submental area and just sort of taking out a little bit of fat, help contour that area. So it's a very routine area to liposuction. I can do it under IV sedation. I mean, technically, I think some people kind of push it, maybe try to do it under local anesthesia in the office. You could. I tend not to want to do that. There's little areas in the body you can do it on. I think it's a little bit better tolerated. But in that area, I think it's just easier to do it under some sedation. But there's very little downtime. It's usually 1 stitch that's under the skin that closes the incision. I do have people wear a chin strap only when they're at home and at night for a couple of weeks with it. And that's just to help decrease a little bit of the swelling. You may have a little bit of bruising with the liposuction, but again, it's not very commonly an area that gets bruised. So I think the liposuction for me is it's a really nice way of doing it. I know I can feel the tissue, so for the most part, most people just need one session of liposuction. I usually combine it with other things. A lot of people will ask, can you combine it with any other procedures? For me, yeah, I could combine it with facial surgery all the time, even liposuction to arms and legs. You can do it with breast augmentation. Some of the areas that we've sort of stretched out is that lump of fatty tissue right here in front of the armpit that women hate. And when you have it, you have it. There's really no way to get rid of it. You can't exercise it away. You can't diet it away. So one of the best ways to do it, at least in the past for me, was just liposuction. If I was doing an augmentation, a lift, a reduction, any surgery, making that tiny 2 millimeter incision, you can get that fat out very easily. But now we've been using Kybella in a non-surgical way, and we've had some good success with it. That fatty tissue is very soft, and I think that Kybella does an excellent job of that. So that's another area that we've had good success with.
Patricia asked, if lipo is applied to the back fat, does the patient still need to go under for back fat?
Yes, and again, it could be done under IV sedation or general anesthesia, depending upon what we're doing. Many times that area is a little bit more fibrous, and so it's a little bit more difficult to liposuction. That's why I think in that area, it's not something I would recommend Kybella for. I think liposuction in that area is generally better handled with the liposuction, just because it's kind of fat, it's kind of fibrous in nature. So for that area, I would suggest at least heavy sedation.
You mentioned about a chin strap. With the Kybella.
I was just going to bring that up.
Mm-hmm.
This is not something you want to compress. You don't want any compression on it. We want that inflammatory response. That's letting the product do what it's supposed to do. So you would not put any type of compression, no matter where you injected.
So I know we stress consultation, so coming in for your consultation, and it seems like Dr. Antimarino and Pamela, you guys have to be on the same page in regards to, say you have a patient who comes in wanting Kybella, but after you meet with them, you realize maybe they need liposuction instead,
Right.
or what would be best. So I was just wondering the importance of a consultation with each one of you, and then how you two communicate to get the best results for your patient.
Again, it's nice because we're here on the same day, and so we can kind of have patients, sort of go between us, and we call each other into the room together. So we evaluate the patient together, and it really depends on the patient's goals. And I think sometimes getting that understanding of what their goals are, then we can sort of offer the both solutions to them. I think one of the things that we really stress in this practice is education. And so I think what we do well is that we put it to the patient in the sense that we're not trying to sway them one way or the other. And I think we try to give them the best information of, this is our estimate, this is what we think it would take, 1 or 2 vials, this many sessions, this much downtime versus, would you be a good surgical candidate? Would we, do I think, and there are some patients that I don't think are good surgical candidates, and then I kind of funnel them towards Pam and what she can do. So I think that's the real benefit of the consultation, is the education for the patient. Then the patient can really make the best decision for themselves. Our job is to provide them with unbiased information, cost analysis, so they can go home and really sort of weigh the pros and cons and make their best judgment. And any way that we can handle or help a patient do that, we're both happy to do. We're not trying to compete or anything else. It's just what's best for that patient.
And if I could interject, I've been learning about Kybella, the injectable, for about a year now, working on your social media team. So I've learned a lot on my own, but within, a month ago, we had our own consultation about what my results would realistically look like. And also Pamela, today we also discussed what my results were going to be after one treatment. So it was great to hear from both of you about what I could expect from the procedure.
So when it comes to liposuction, if say someone was coming in for liposuction to the abdomen, can they also say, I would like to get, while I'm doing that, I want to get the segmental region?
Exactly. So when patients come in, usually with liposuction, they're usually thinking of at least one area. And so when I go through it with them, there is, I guess there's some terms out there, lipo 360 and some other things. It's very common to do multiple areas of liposuction. So arms and belly and legs, it's hips and abdomen are almost completely together all the time. So, and in that sense, you do the hips actually from the back. I actually put the patient on their belly after they're sedated or under anesthesia. I actually put them on their belly, do the hips from the back, then flip them over on their back, and then do the rest of it from the front. So we can do the back fat or the bra rolls, the thighs at the same time, and I do even from those back and front. So it's basically is a 360, and so any areas that you're looking at with the liposuction cannula, there's very little areas that we can't get to with a liposuction cannula. From the neck, chest, abdomen, armpits, back, hips, legs, all the way down to the ankles and calf area. That actually contours beautifully. So the only area that we can't get to, and this is a common thing, is there is a difference between external fat, and so that's the fat that sort of is alive outside of the muscle wall of the belly and the skin. That if anybody's old enough for the Special K pinch and inch, that's the area that can be affected by a liposuction cannula. All the stuff that's inside, what we call visceral fat or internal abdominal fat, that area, that's the fatty tissue that's around the intestines, and that sort of gives you the old saying about a beer belly. So you have that sort of that barrel look, and you can't pinch an inch on those patients. It's all internal. You cannot put a cannula in there. You'll damage the organs and the intestines. So that area is best tackled by diet and exercise. So that tissue is the most unhealthy. So when you see patients like that, you have to start really thinking about heart disease and the future blood pressure issues. So the nice thing about that is that fatty tissue is actually better controlled through diet and exercise. The tissue on the outside of the abdominal wall that we're talking about with either Kybella or liposuction is harder to lose or harder to control with diet and exercise, but of the two, it's a little bit healthier fatty tissue.
Rochelle wants to know, does this help TMJ or is that just Botox?
That's just Botox.
Right.
Will help TMJ.
That's a great question, though.
Yeah.
Again, the TMJ problems are usually, it's either a problem with the joint anatomy, but it can also be that the big muscle, one of the big muscles that is down your jaw that help you chew is the masseter muscle. And sometimes without knowing it, we clench our jaws, and so sometimes that muscle goes into spasm. And so anytime that we're trying to relax a muscle, the Botox is really the best choice in that matter.
So when it comes to, you're talking about diet and exercise for liposuction, when it comes to Kybella, is there ever a possibility that with diet and exercise that submental chin region doesn't go away? And that's when like you would recommend Kybella? Or will diet and exercise always get rid of that?
I guess it's different with every person, whether diet and exercise will take effect and help the area. Usually people will come after doing diet and exercise and saying, I can't get rid of this area, so what can you do for me?
Right. I think that's the most common. What we
Yeah.
see is patients that will say, even when I was 10 or 20 pounds lighter, or even when I
still
was in
felt
high
it.
school, I always had this. And so we see a lot of people, and that's sort of just your genetic predisposition, and some people just carry it there. Some people, as we get heavier or we gain weight, I think people don't realize you gain weight from head to toe. We all have areas where we deposit fat more in other areas. So, for men, it's usually around the waist, the love handles. For women, it can be sometimes the back fat, thighs, and around the belly as well. But what they don't realize is you're actually gaining weight in your face and arms and legs. And so that area can get worse with weight gain, but in this area, it's usually pretty isolated. And same thing here on that front part of that armpit. Either you have it or you don't. And when you do have it, it's really hard to control.
What about the fat that hangs below the belly button? She calls it fanging fat.
Calling it what?
I don't.
So that part of the lower belly, again, that's skin, that's fatty tissue on the outside of the abdominal wall. That tissue is amenable to diet and exercise, and depending upon your age, hormonal balance, especially for women, sometimes that's easy to lose, sometimes it's harder to lose. As we get older, that area is harder to lose. So that area is much more amenable to liposuction and I wouldn't suggest Kybella for that. Again, because it's such a large area, you'd have to use a lot of Kybella, and then it becomes so cost prohibitive that it's actually just less expensive or more cost efficient to just do the liposuction. But that's a popular area for liposuction. It does very well.
She corrected me. It was hanging fat.
Okay.
She had a spelling.
Okay.
She wants to know if 60 is too old for that.
60 is too old for liposuction?
Or Kybella.
No, there's really no age. When you're talking about surgical, then we look really more at the physiology of the patient. And we have patients that can be 70, 80 years old and in good physiologic health. So surgery, I'm not even talking about liposuction, but other surgical procedures are really not an issue for them. Kybella, I don't really know too many patients that would be a contraindication for
Right.
Kybella.
Would skin elasticity affect the results at all?
Definitely.
Okay.
And so as we get older, and so we're talking about 35, 40 and older, that's when you start having to think, well, with these products of Kybella or the procedure of liposuction, debulking that fat, you're relying on the skin elasticity. You're young ladies and you have good elasticity, so that skin really should recoil and redrape for you. Somebody that's my age now, where I'm starting to get a loss of elasticity, if I had that fatty tissue there, it would maybe worsen it. And that's some of the things, that's one of the reasons we talk about it at the consultation. The abdomen is the same way. It can kind of, once you take that fat out by any means, if the skin doesn't retract, now you're looking at having some extra skin, and then maybe you're looking at down the line maybe a tummy tuck to take care of that.
So before we wrap it up, Pamela, I was hoping, so you spent a Monday the past couple weeks at the Allergan Medical Facial Aesthetics Master Course. So I was just hoping if you could give a quick recap of that experience.
It was a good day. We went over a lot of different products and that Allergan has and that we use, and basically all the procedures that we do as well, and just different techniques that different people use. So we learned a lot there. We brought a lot back. Not that we don't do all the procedures already, but I think it just helps you to continuously go to classes and keep learning and learn from others. And it was a really nice course. I also wanted to let everybody know that Kybella is just like liposuction. Like once you get your desired area to where you want it to be, fat will not come back in that same area. Just like liposuction, it may go someplace else, but it's not going to come back in that same area. And that's why a consultation is very, very important. A lot of people will come in and think they're a candidate for Kybella, but they have like loose skin in the turkey neck. There's no fat there whatsoever. And you know, I'm honest with them, like it's not going to do a thing for you. Don't waste your money. If it's just loose skin, that's something that they would want to see Dr. Antimarino about. If there is fat there, then yes, let's talk about it and let's see what you can do.
How are you feeling, Beth?
It hasn't changed at all in terms of like feeling. It still just feels a little bit hot, but it doesn't hurt to turn my head or anything. Doesn't hurt to do that. It feels fine. It'll be all good for tomorrow.
All right. Well, listen, thank you so much for joining us tonight. I hope it was very educational. We'd love to see you here if you have any questions. You can visit our website for more information. Please visit our Facebook page and enter to win a facial. We also have the May specials coming out tomorrow, and so May 1st is tomorrow, and we have some good specials for you. We also have, we'll allude to tonight, but we have a new device that we have just brought to the practice. It's the first one in Pittsburgh. So we are at the cutting edge of this new device. Once we get it set up, we will have a Facebook Live on it, and I think you'll be very happy with it. We're excited. I've been excited about this machine for quite a while, so it has become a reality. So we are going to launch that pretty quickly. So again, any questions, visit our Facebook page, and we'll see you next month. And happy Mother's Day.